Good evening. Hope you guys are surviving daylight savings time. Well, housekeeping. I just got back from the Canyon Ranch in Tucson, where they don't celebrate uh, daylight savings time. They don't switch the clocks, so got a little bit more daytime in the evening there than I'm currently getting in St. Louis. But just got back from the health and wellness retreat I did with about cardiology. So we had some people that I see as patients, and I had some people who just follow me from social media that heard me on different podcasts and were interested in meeting me and spending some time in the desert, talking about health and wellness topics. We talked about mitochondrial function, talked about exercise. There were some Zone 2 lectures that I attended and help summarize. And we just got to meet people who are on the like-minded journey. So potentially we'll be doing this again next year. So thank you for those that came. Thank you for those that actually went out hiking with me. This was a kind of a warm-up trip for going to Kilimanjaro next year. So, I get to say that I passed the test that I wanted. So 4 days of hiking, 20 plus miles. I think there's, over 9,000 feet of elevation on those 4 days. So I got my legs stimulated pretty well over the past couple of days. The other piece of housekeeping is that I'm working on revamping my Skool community. Skool is where I do more of my education than just the free podcast and these IG lives that I do. There are monthly Q&As, which go for at least an hour, and a little bit more back and forth. It's like Zoom, or it's the Skool live app, so people can come on like this, ask a question, and get answers. And then there's areas where I've released different courses: how to read your own labs, how not to die, so what cardiovascular testing you should get with your local doctors, local cardiologists, to make sure your atherosclerosis risk factors are addressed and your plaque is treated. And then my goal is to have a Friday kind of fun fact. So I'm going to put a poll up later today in my Skool community for those that are in there already. You can vote on the poll, and whatever's upvoted to the highest topic, I'll put together 5 to 10 minute video every Friday on the topic. And then the goal is to have monthly first Fridays, the calendar filled out ahead of time. I'm going to look at Q1 for next year and the next week. There was people who wanted it to be in the morning time, so we do some what I call coffee and cardiology talks. And then some people, need it more afternoon, so we'll do some lunch and learn. So if you're interested in more education than what I can do on Instagram, Skool community is where to go. Check it out. It's just basically skool.com. My group is becoming hardtack proof, but if you go to my bio on Instagram, there's a link to the Skool community. So with the housekeeping out of the way, we'll jump into the questions tonight. So question number 1, can an inverted posture like a headstand or shoulder stand have cardiovascular benefits? None that I know of, and also not likely to cause any harm, as long as you can do it and don't injure yourself. Does cold plunging benefit the cardiovascular system? Indirectly by lowering inflammation and helping with heart rate variability. Cold plunging is more about mitochondrial efficiency at producing energy, and may help with body composition changes by activating brown fat. So indirectly may affect metabolic health, which then affects vascular health. What side of the arm is best to take your blood pressure on? The short answer is whatever arm is the higher blood pressure. So for patients that come see us at Cardiology as initial patients, they will know that we take blood pressure on both sides, because some people have a differential in their blood pressures. If the blood pressure is 20 points higher on one side, there may be an issue that you have subclavian stenosis, where you have a blockage in the artery in your arm and you have a falsely low blood pressure to that side. Or you may have an issue with a nerve that essentially is causing the smooth muscle in the artery to constrict and raise blood pressure to that side. So you should check blood pressure on whatever the highest side is. All right. All right, somebody asked about nattokinase, which helps pick up fibrinogen. They had mentioned the high form dose, 10,800 units, versus aspirin. Would you use it for a 70% blockage in the LAD former cleared carotids. So by clear carotids, I would read that as carotid endarterectomies. So this person is a very high-risk individual for having another cardiac event. I would take aspirin for sure to reduce the risk of stroke or heart attack. Nattokinase is a discussion you need to have with your doctor about what is your bleeding risk. That would be the biggest concern about taking aspirin and nattokinase at the same time. Nattokinase is mainly used if you have high fibrinogen on blood testing. Is it possible to repair scars in the heart muscles caused by extensive troponin? So, reading into this question, troponin wouldn't cause scar tissue in the heart. Troponin is a protein in myocytes. If a myocyte is basically all right. Next question. How often should you check your blood pressure? Whatever often your doctor recommends. But if you have blood pressures that are above 140/90, you probably need to check it twice a day until your blood pressure is normalized at 120/80. So check it first thing in the morning. You want your feet on the ground, your back supported with the chair, your arm at heart level, and check your blood pressure on the arm that is highest. You want a blood pressure cuff that fits your arm, isn't too tight or too loose. Then generally check in the afternoon or early evening and see that there is going to be a fluctuation in your blood pressure. It's due to circadian rhythms. Generally, your blood pressure is going to start to rise early in the morning and start to drop later in the evening time. All right. Next question. Is an injection for sestamib, rest, and stress tests safe on your heart as a treadmill is not possible? I think I've answered this question previously, but this is something where, what is the reason the person is having a stress test? If you are having symptoms, chest pain, shortness of breath, exercise intolerance, then you want to do a stress test. You can look at different ways to do the stressor. If the person can exercise, a treadmill stress test is always recommended because you get other information. You get their peak heart rate with that. You do not give a dilator. You give it through the IV, the arteries dilate. You give the sestamib, that is the radioactive material that the myocytes take up. If there's an area of an artery that has stenosis, quote, all right. So those were the pre-submitted questions. Now the ones that submitted in the comments. So somebody says that they are 63-year-old, 10 years into menopause. They suffer from hot flashes. So that is something where I think, okay, now I added some more information. Said, thinking of going on heart hormone replacement therapy. The inflammatory markers hot flashes are something where is common with the reduction in estrogen, the perimenopause and menopause. The hot flashes are a vasomotor symptom that can be a marker of endothelial dysfunction. Not everybody gets hot flashes in menopause, but those that do, possibly they're more at risk for vascular complications down the road with this loss of estrogen. Those are the patients that may benefit more. And I'm just saying that from opinion, not from studies. The side effect profile of hormone replacement therapy done right is very low. Granted that you don't have a history of ovarian cancer, breast cancer, or high risk for thromboembolic events, history of deep vein thrombosis or pulmonary embolism. If you work with a provider that keeps your levels in kind of the range where you were before menopause, low risk from my standpoint, from my cardiovascular condition. When do I consider a person has high blood pressure, and what will you recommend the person do first to reduce it naturally? So high blood pressure is anything over 115/75. Newer guidelines are recommending that the systolic blood pressure be treated to at least less than 130, but ideally 115 is optimal. If your blood pressure is 135/80, you have a 20% increased risk of stroke compared to when this person first due to treat it naturally. Well, I usually talk about 4 pillars of health. It's exercise, nutrition, stress management, and sleep. Look at which one of those 4 is most impacted and attack that one. Oftentimes it's sleep, so fix their sleep if you can. But exercise is the best treatment for this, most likely. So combination of cardio and strength training. Dietary wise, probably consider a DASH type of diet, the dietary approach to stop hypertension. And then if you have access to monitoring heart rate variability or biofeedback, do something like, Respirit or HeartMath to balance the autonomic nervous system. Then lifestyle things that, don't keep things under control. Then look at different biomarkers, oxidative stress and inflammation. Look at markers that affect nitric oxide. There's genetic testing that can be done that can tell you what is the likelihood that it's, genetic, because the greatest majority, well over 80% of hypertension is genetically driven. So you can, we definitely recommend doing all the lifestyle interventions, but if not getting to goal and you're at high risk for a stroke or heart attack, then use the testing to figure out which pharmaceuticals are more likely to work for you. So somebody's asked, what causes the heart rate to vary widely? That's too broad of a question. I would not know without more details. But in general, heart rate should be between 60 and 100. The sinus node in the right atrium is the pacemaker. If the heart rate is fluctuating wildly and the person is at rest, you would be concerned that they have supraventricular tachycardia or atrial fibrillation. If it's with exercise, that can be normal, or they may have inappropriate sinus tachycardia. So it would require a further history, physical exam, an EKG at baseline. But most likely, if you really have significant fluctuations, wearing a 24 to 48 hour Holter monitor to figure out what your average heart rate is and look at these swings in heart rate. All right. So I'm not seeing any other questions coming in, so I'll hang out for a minute or so. For those that are joining a little bit later, did give a quick summary of what the Canyon Ranch experience was like. I'll likely be doing another one next year. It was awesome. Great hiking, great blue skies, lots of sun. There's not a lot in St. Louis this time of year, so it's a good sun run. And just great meeting other people who's interested in optimizing their health span and longevity. If you're looking for more than what Instagram will allow me to do, my Skool community is where I'm dropping these nuggets of information. I will have a monthly long-form Q&A, a lot more interactive than what Instagram allows, the features. So you can actually jump on there and talk to me, and I can actually kind of understand a little bit more people's backstory. I'll start putting more kind of Friday fun facts in. So I'll let the Skool community upvote what they want to talk about. So if there's a topic, zone 2, for example, or photomodulation, or circadian rhythm management, or biohacking with glasses, I'll talk about whatever topic people are interested in. So if you're interested in that, check it out at skool.com. And my community is becoming heart attack proof, or you just search for my name, Dr. Twyman, you'll be able to find it. So hope you guys are having a great week. Hope you get some sunshine when it's available to you. I know it's time to go into the hibernation mode for most people. If you have a lot of darkness at night, that is good for your mitochondria to make more melatonin. So embrace the darkness. So somebody says they don't see the Skool community on my website. It's not on my main website. It's in the bio link in here. But if you go to drtwyman.com/Skool, Skool, it will take you to the link that the Skool community is attached to. So hope you guys are going to have a great week, and I'll see you next time.